Lali pula. Lali Syafiq muka mana? Siapa present?
Ni Dr. Nur Azrin Farhana.
Group apa ni?
What?
Group apa?
Group 2. Group 2.
Group 2 lah. Siapa present?
Saya Nur Azrin Farhana. Nur Azrin Farhana.
Okay.
Okay, so we start with chief complaint first.
Introduce your patient dulu.
Pardon?
Introduce your patient.
Interview. Assalamualaikum. My name is Nur Azrin Farhana.
Introduce your patient.
From chief complaint.
Apa pula? Budak tu tak ada nama ke?
Anissa.
Nama, umur.
This patient, her name is Wan Anissa Akilah, and her age is 9 years old and 8 months old. Okay, so Anissa is a girl.
Present semula.
So this patient, Anissa, a 9-year-old girl, was admitted to pediatric ward HTAA due to fever and lethargy for 5 days duration. And on history of presenting illness,
fever berapa?
5 days of duration.
Fever for 5 days dengan?
And lethargy.
For?
Also
5 days.
5 days.
Start semula.
So this patient, Anissa, a 9-year-old girl, was admitted to pediatric ward HTAA due to fever for 5 days duration and lethargy for 5 days duration.
Dia tahu tak? For 5 days ni, 4 tu dah indicate duration.
For 5 days.
Repeat semula.
So this patient, Anissa, a 9-year-old girl, was admitted to pediatric ward HTAA due to fever and lethargy for...
Fever for 5 days. Buat semula. You ni masih tak dapat I punya point tu.
Okay, my patient, Anissa, 10-year-old girl, was admitted to pediatric ward HTAA.
Semula, lelaki atau perempuan? Semula.
My patient, Anissa, a 10-year-old girl, was admitted to pediatric ward HTAA due to fever for 5 days and lethargy for 5 days.
Sedap bunyi. Okay, continue.
In history of presenting illness, Anissa was apparently well until 5 days ago when she started to develop fever. On the first day of her fever, she described that the fever is sudden in onset, continuous in nature, and it did not change in intensity during the day or night. The temperature was not documented by her mother. Occasionally, the fever did disturb her from sleeping and even after taking bath, and the fever was not resolved. She had taken tablet paracetamol at home and she felt better after that. She said that the fever was bearable when she able to do her daily activities at home during weekend. The fever was not associated with chills, rigors, night sweats, or skin rashes. On the third day of fever, she said that the fever still persisted and she started to feel tired and weaker, which forced her to be absent from school. It is also associated with loss of appetite as her oral intake being reduced, and usually she could finish the whole meal, about half of plate, 3 times daily, but due to loss of appetite, she barely finished half of the meals. Otherwise, she drank water about 7 to 8 glasses per day as usual and said that the frequency to the toilet was normal, but she is unsure of urine output and the color of her urine. Other than fever and reduced oral intake, she said that she had mild abdominal pain localized around umbilicus and non-radiating, colicky and intermittent in nature, with pain score of 5 out of 10. The
Kau
pain did
pindah dalam history pain score tu boleh dapat.
not yet.
Continue. Continue.
The pain did not relieve by leaning forward or taking meals. There was no any other exacerbating factors related to the abdominal pain. Otherwise, there were no altered bowel habit, no changes in stool color, or any symptom related to urinary tract infections. She also complained of having occasionally mild frontal headache, persistent and sharp in nature. The headache was relieved by rest and intensified during hot weather and doing activities. However, the pain was not associated with nausea, vomiting, retroorbital pain, blurry of vision, photophobia, or neck stiffness. The fever was also associated with mild dull knee joint pain, which pain score of uh, which did not affect her daily routine. Otherwise, no other joint pain, psoriatic patch, or previous history of prolonged fever with painful joint pain. On the fourth day of February, she went to school as usual as she felt better in the morning. At the school, she had the learning session and sport activities. Otherwise, she said that she's still able to play with her friends and concentrated during classes. Later in the evening, when back from school, she felt really tired, which made her parents to take her to nearest clinic on the next day. So on her fifth day of February, her father took her to klinik kesihatan Bukit Sekilau for treatment, and there vital signs were taken and the temperature recorded was 39 degrees Celsius, and tablet paracetamol was prescribed. Blood tests also done and full blood count result show low total white cell count and low platelet level with high suspicious of dengue fever. Then, rapid combo test was done, which show positive result for NS1 antigen and IgM antibody. Immediately in the evening, she was taken to HTAA by ambulance. At emergency department, full blood count and rapid combo test was repeated. And saline solution was given and she had been transferred to the ward. On second day of hospitalization,
Well, HOPI is only until admission. Finish. Are you finished your HOPI?
regarding history,
Have you
HOPI
finished
of
HOPI?
for no, not yet.
Hmm?
Not yet.
Apa lagi you nak add for your HOPI?
Anissa said that in the last 2 months, fogging had been done in her neighborhood housing area, and otherwise there is no recent fogging, and she did not involve in any water recreational activities or playing with contaminated soils or any recent traveling to malaria endemic area. Okay, so that's it for HOPI.
Finish HOPI.
Yes. So doctor,
Nanti dulu.
okay.
Anis, ada question?
I would like to know if she still have fever during.
Apa tak dengar?
Hello.
Ah,
I want to know that if she still have fever during the clacking and when was the last time she take the paracetamol.
Aslin apa jawapan ha?
Her last time taking paracetamol is on 50 of before admission. 50 of February she take paracetamol prescribed from klinik kesihatan. And she was hospitalized on the same day.
Okay, Nek Kamila.
I would like to know if the patient, if the mother or patient noticed that any shortness of breath or any, yes.
Apa?
If the mother or the patient noticed any shortness of breath.
Dia.
There is no rapid breathing or shortness of breath noted.
Dia no?
No.
Arun? Senyum dia. Cepat ha?
Okay. I want to know, is there any family member came with a similar symptom with the patient?
Yes. On second day of hospitalization, the siblings, her younger brother got hospitalized with symptoms of low-grade fever and having vesicular generalized skin rashes, and also appear with vomiting.
Noain?
I want to ask if the child has any child rigor or any night sweat.
No, as stated in the HI already, there is no night sweat or rigor.
Tengku Nurin?
Can I ask about why this patient they do not do the tourniquet test? Any indication for tourniquet test? Tourniquet test.
So during check in the klinik kesihatan, the tourniquet test was not done. I think it's not mentioned in the case write up, but tourniquet test is helpful in to diagnose the dengue, and it's helpful in early February phase. But here we can do the tourniquet test to check for hemorrhagic tendency, and also we can do when there is when we don't know the platelet count. When the platelet count is normal, we can do tourniquet test as well. But
Siti
this one,
Noisyah?
I would like to ask, is there any bleeding tendencies like nose bleeding or gum bleeding?
no, there's no other significant bleeding symptoms.
Okay.
Laili?
I want to ask about the any urological symptoms like increased frequency of urine or maybe dysuria and the color of the urine.
Based on the history of present illness, there is no frequency. The frequency was normal, and her urine output, she is unsure of the urine output and the color of urine. Okay, that's all.
Syafiq?
I would like to know if the patient have a history of sore throat.
There is no history of sore throat.
Afiq,
I would like to know if there is any symptoms of dehydrations like dry mouth or lips or feeling thirsty.
She did not mention of having feeling thirsty, as she had drink water about 7 to 8 glasses per day, so it's adequate with her needs. And then on physical examination, it is noted that she had dry lips and dry lips.
any other questions? Any other questions?
Does she have a neurological symptom such as seizure?
No, she does not have confusion. The neurological system was good.
No conclusion lagi. Any other questions?
Is there any myalgia or bone pain?
No, there is only arthralgia with her mild knee joint pain.
Ya, ada tak ada mention magia tak?
No.
Your case ke somebody else case?
Somebody, the senior case,
Ya, ada tak ada mention magia?
not mentioned, but
Not
she
mention
only had.
that is, kalau not mention, you see, kalau not mention, it means that what it means. It's not there ke, or he or she didn't ask.
Maybe not us, but she had
Kalau he
arthralgia.
asked about it or it's crossed to her mind, definitely she going to mention it if there is a magia or not, is it?
Yes.
But she didn't mention it. It means that she didn't cross her mind. She is unable to tell us into a positive or negative history. Any other question? From what?
No. It's okay.
I would like to ask one more question. Does she live in dengue prone area, and is there anyone in her housing area been diagnosed with dengue fever recently, except from her brother, right? Is there anyone been diagnosed?
It's not
Oh,
been
soalan ni
mentioned.
tak faham semula.
Okay, I would like to ask, does she live in dengue prone area, and is there anyone in her housing area been diagnosed with dengue fever recently, except for her brother?
Based on the HOPI, it is the dengue prone area because the fogging was done before, but there is no recent fogging, and it is not mentioned that other neighbors associated with dengue fever. Only her younger brother was stated.
Younger brother was diagnosed dengue.
Yes.
Any other questions?
I would like to ask if she had any previous dengue infection.
No, this is first time primary infection.
I would like to ask if the fever is associated with diarrhea.
There is no diarrhea, and she did not realize any loose stool.
Any other questions?
I'd like to ask about her nutritional history. What does she eat in a day?
Dia makan tu spaghetti je hari ya.
Yeah.
Apa dia pakai spaghetti? Hari-hari dia pakai makan apa?
On nutrition, she eat proper meal, rice, chicken, meat, and carrot. For dinner, she had all portion of
Carrot dia tak
carbohydrate.
makan. Bayam, bali tak makan. Kangkung dia tak makan.
She also
Eh?
eat vegetable. She is not a picky eater.
Any other questions?
Her immunization history. Does she receive all immunization according to Ministry of Health Malaysia?
Yes. The patient vaccinated.
Can I add on the
No more questions. Anis, how bad the fever is? Anis?
Yes, Doctor.
How bad the fever is from the history?
I think it's low grade because it is not associated with cheese and rigors.
Low grade because it's not cheese and regals.
But
Bad to
usually,
mild, moderate, and severe. How bad is it?
um, I think it's moderate. It's not severe. It's I think it's moderate.
You think it's a?
Moderate fever.
Why?
Because she still can go to school even though she has fever, and she said that it is bearable.
Can go to?
School. She can stay undergo her activity
She can still undergo her activity.
daily
Lagi?
life.
She don't have cheese and regal lagi?
It is not disturb her sleep.
Disturb her sleep lagi?
Lagi.
What about when the fever at the end, when at the day of admission? How bad the fever is?
Day of admission. She it is noted that it's 13 during the KK is 39 degrees Celsius.
Yeah?
39 degrees Celsius. But she
Berapa? 39?
Degrees Celsius during the at the klinik kesihatan.
Klinik kesihatan? 39 tu tak tinggi ke? So the temperature is 39 degree. The child able no cheese and regal. The child able to go to the school. On the first day of fever and the fifth day of fever, on the berapa hari fever dia? 5 hari kan?
5.
On the day of fever, first day and the fifth day of fever, any changes tak?
It's gradually worsen. Worsen.
How you know it's worsening?
Because before she can do her activity daily life, and
then after that
she start to have lethargy and other symptoms.
ada symptom, apa symptom ni lain?
She have reduced oral intake.
When?
When? Reduce oral intake
First day,
on
fifth day.
reduce on day 3 of the illness.
On day 3.
Yes.
How you know reduce oral intake?
She said that before she eats from the whole meal, she eats half of the plate, and then it's reduced to the 1/4, 1/4.
Ha?
1/4 je plate.
1/4?
4. Hmm.
1/4. Hmm. 1/4.
Yes. She barely finish half of the plate like usual.
Ha?
Habis makan, selalunya dia makan separuh.
Selalu dia?
Selalunya dia makan separuh pinggan, and then dia reduce separuh pinggan pun tak habis.
Mungkin dia makan, dia increase dia punya mak letak banyak tak? Daripada biasa dalam pinggan dia.
Tak pasti.
Tak pasti. Ha. Don't you think dia tak pelik ke?
Yes.
Adik dia ada denggi, mak dia hari kelima baru jumpa baru datang ke klinik, ke KP ke KD, tak pelik ke rasa?
Adik dia dia masuk dulu sebelah adik dia.
Tak faham history dia.
History dia masuk hospital dulu. On the second day of admission baru adik dia masuk hospital.
Ya.
Yes.
Yelah, very confusing lah. Okay, Nik Kamila, how bad the lethargy is? Dia dua chief complain kan, fever for 5 days, lethargy for 5 days. So how bad the lethargy?
She couldn't go to the school because of that lethargy.
Bila?
On day 3. She
Day
started
3.
to feel tired on day 3, which makes her absent during that day.
Lagi?
And also because of the reduced oral intake.
Oral intake tu because lethargy ke atau because of fever?
Due to because of both, I guess, fever and she feels tired.
Because of fever she feels tired, or because of illness, infection tu dia feel tired, lethargy, which one?
Because of the
fever dia macam mana, Anis? Fever dia persistent ke, intermittent ke atau ni?
From the HOPI said that continuous. Continuous.
Persistent fever, betul Azrin? 5 hari fever dia tak kebah-kebah.
Yes, persistent.
Persistent fever for 5 days.
Yes, but it becomes worsen on on 5th day.
On the 5th day. Kak Mila, lethargy macam mana?
lethargy because of she didn't eat, and then because of lost appetite, I guess she felt tired because of that.
Yeah.
Yes.
So how bad is it lethargy? She deteriorate, but is it bad lethargy? If very bad lethargy, what you expect the patient going to be?
She couldn't even do anything, lies in bed only.
What about this patient?
This patient, she only did not go to school on the 3rd day, and then the next day she felt better in the morning, day 4. So only that day. On day 4 she felt better in the morning. However, in the evening she felt tired again, which makes her father send her to the clinic the next day on day 5.
On day 4?
On day 5, on day 5 she went to the clinic. However, the condition was not mentioned. What condition on that day?
What you want to know about day 5 though? Talking about lethargy. You see, lethargy is chief complaint. Once you put things in chief complaint, it has to be very detailed. It's what, because it's one of the complaints. So what you mean by lethargy and day 5 though? If you at your you want to know history talking lethargy complaint day 5 though, you think if you want to decide how bad this lethargy is, what you want to know?
Is she able to talk, walk?
Talk semua orang terbaring boleh cakap.
If she is bedridden.
If she is able to walk lagi.
Play usually normally.
Need somebody help her to walk. Lagi apa lagi?
Eat.
Okay, fair, eat. But she can she do all those things?
That was not mentioned here.
Why didn't cross your mind to ask? You tak cross your mind to ask?
I missed that. I guess I missed that.
You missed that?
Yes.
Macam mana ya? Okay. Because why is it I'm particular about that? Usually I don't bother to ask so much. Why I'm particular about that? I'm particular about the fever, I'm particular about lethargy. Why? Why?
It is the chief complaint.
Yes, it's a chief complaint. Once you put things in chief complaint, you must able to characterize it. That's why very important. You must understand chief complaint all about. If lethargy is just a complaint of lethargy after the fever, those things, then you say, perhaps it's just related with the fever. But if the mother inform you my child is lethargy, then it's one of the chief complaint. So you have to, because lethargy can be a sign of what? Neurology disorder. So very important when when you ask the parent what the chief complaint, the parent, you know what chief complaint is. Chief complaint is what is the cause the patient came to the hospital. So once your patient told you identified lethargy or fever is a chief complaints or the chief complaints, you have to characterize every chief complaint before you decide it's just a fever only. Unless you decided that the chief complaint is only fever, the rest is not a chief complaint, something associated. That's why very important. You have, when you identify the patient, you identify the chief complaint, because that's going to be your pathway or your thought process. All other class tahunya. Once you identify the chief complaint, I'm going to ask how severe the chief complaint is, each one of you. Because I want come in your mind, everything will come to any chief complaint, you already decide. When you listen to the history, you can determine the severity of each chief complaint. because that will be your important to know the severity, because that going to be your to help you the level of your management. Okay, Azwin, what is your essence of your case? You got two essence of your case I want to discuss. One is
fever, 5 days duration.
Mula cepat.
So this case is a 9-year-old girl with fever
With fever.
and
Okay,
lethargy.
now. So on the first day, this 9-year-old girl with fever. So where the next thing come to your mind?
Severity.
Why, doctor?
What the next thing come to your mind?
Why she had a fever?
Huh?
Why she
Pardon?
had a Why she had a fever?
Pardon? Why?
Why a fever?
Why she had fever? Can you make it lagi, your investigator, can you make the questions more specific?
Why she had a persistent fever?
Had to is what you mean by had? Anybody?
Causes of
Hello.
fever.
Salam, Prof. Hussein. It's okay. I just want to ask you, when I go to the web, science of web, so I noted that is IUM Medical Journal. Is an old name or is it a different journal? Oh. Oh, not local based. So now your name is IUM Medical Journal. Okay, okay. No, because I go back science, I try to find your journal names. Coming out is IUM Medical Center. So I wonder because I look at it last time to International Medical Journal. No. Because when I go through this called another web science, you can science law, another one though. Can I go through all the 10 journal of Malaysia, you put that International Medical Journal. So when I go to science of web, then noted that is IUM medical journal. This not international medical journal. So I wonder if we have two medical journal or not. Same okay lah, it's okay. So now your name is IUM medical journal, your name, not international anymore. The same thing. Same, okay. Okay, it's okay. I just want to ask that one lah. That's all. Sorry about that. Okay, thanks. Sorry, this is Waalaikumsalam. Okay. Okay, where are we just now? So what the next thing come to your mind?
What is the onset of the fever?
Only lah. This is then your child with fever. What will come to you important thing that you want to know? Is that you are an investigator?
Is it immunization?
So yeah, mine.
Temperature.
Let's say they see your patient, you see the patient at day 1. The child coming or day 2, the child coming with fever. What do you think come to your mind?
Is it whether it is associated with infection? Whether it is associated with infection.
We started with what you want to know. You want to know what causes of fever. Tak tahu macam mana nak mengajar lagi. You want to know what causes of fever, itu je. Because your job is to solve the patient fever. So what the possible cause of fever during that time?
Most likely to be dengue fever.
You see, that's why it happen to you all. You become biased. I do day two of fever. Do you know it's dengue, not dengue during that time? That's why actually I don't like straightforward case like this because it doesn't develop your brain at all. What possible cause of fever?
Infection.
Can you list? Can you be more specific? You are going to be doctor tau. Infection ni orang kampung cakap, orang layman dia cakap infection, infeksi. For you all?
Maybe influenza infection.
Lagi?
Malaria.
Lagi?
Typhoid fever.
Lagi?
UTI. Urinary tract infection, otitis media.
The way you jawab apa I know. You punya the way you jawab I know you is not systematic. Cari fikir. Still unable to systematic lah. Kita kena fikir. Ada tu letihnya lah.
I think we should classify the cause of fever like it may be due to infection or autoimmune, drug-induced or malignancy.
But do I ask you classify or not? I ask you what the cause of fever. Meningitis, encephalitis, pharyngitis, tonsillitis, rhinitis, otitis media. Apa lagi cakap? bronchopneumonia, urinary tract infection, pyelonephritis, measles. Tak boleh terfikir macam tu. InsyaAllah, teruknya. SLE ada. All those connective tissue disease. Tak boleh cakap, tak boleh fikir macam tu. Cannot think. Kenapa otak you terlalu banyak sangat block tu? So if the child got rhinitis or not? If the child have pharyngitis,
No.
if the child got meningitis,
No. No, in this case, there is no meningitis, no rhinitis.
You don't know, I did too. That's why this case is bias case. Make you all stupid. You cannot explore your mind. You cannot explore your mind at all. You don't know. It's not you're not fitting, no history of fit, no history of ni, tak ada tau. But your child got some headache. That's all, is it?
Yes, my frontal headache.
Because the chief complaint is fever. This is fever. 5 days ago, started fever 5 days ago. With what symptom during that time? Fever with what?
Lethargy.
Yeah, tapi you also focus on positive sign saja. Do you positive negative sign ada tak? Is there any
There's no
complaint?
rashes. There's no rash.
Rash lagi?
No chill, rigor or night
They
sweat.
tell you not because of fever. There is talking about fever, positive sign. I want to talking about causes of fever. No ear discharge lagi. No cough, no
Sore throat.
Aku stupid sangat. Tak nak fikir benda macam tu. Oh, the negative sign. Susah nak fikir benda macam tu.
This also stated this patient has no neck stiffness, no photophobia, no retroorbital pain, and also vomiting.
So
no meningitis.
If you have no neck stiffness, it means that you can exclude already the meningitis. You mean that all the cases with of the meningitis must have neck stiffness? What do you think?
I think yes.
Okay, what the next thing about this case after 5 days? Lali, Tengku Nurin mana?
Me.
Okay. What the next thing come to? The next thing come about this case?
The causes of fever.
You talking about cause of the fever? Then after that,
the sign and symptom to
Okay, you
exclude
finish
the
fever this case. Now we finish. We're talking about fever. We're talking about the causes of fever in this case also. Ni, we'll go through. Ada kita go through lah. Now what the next thing come in this case? When the fifth day, at the fifth day, you got the diagnosis.
systemic review.
Huh?
Systemic review.
Yeah.
Systemic review of the patient.
Laili.
Maybe you can explore about the cause of lethargy, because again, lethargy is industry complaint.
You go to the fifth day or already. You already know the diagnosis.
Oh.
Shafiq?
I think we look at if we already have the diagnosis. I want to know if there are any complication about the diagnosis and also the severity of the diagnosis.
What the essence at that case at the fifth day? This 9 years old child who are having
persistent fever for 5 days.
Inilah. Afiq, this 9 years old child who are having
febrile phase dengue.
Dengue. On the fifth day, you already know it's already dengue because of the symptoms and the sign and even the test been done. This evolution of the case. Now this is 9 years old child who's having dengue. So what you want to know when talking about this 9 years old child having dengue? Lady.
The phase of dengue that she's in right now.
Phase of what? Okay, you want to know the phase. What are the thing? What the thing that you want to know? Anis. Yes, you know you want to face, but basically the face tell you the things. But what you want to know?
Warning signs.
Because that will be the
management
basis of your management.
Yes.
Ni Kamila.
Yes.
You want to know the basis sign, all those things. What you want to know?
The presence of other warning signs of the patient, or if
yes, we know that. What we call them. What the warning sign tell you?
Impending shock, signs of impending shock.
Well, what it tell you? What it tell you?
They increase capillary permeability.
Kado?
The severity of case.
It tell you the severity. You want to know how severe the dengue is and the complication. So what the basic knowledge you have to have if you want to go through this case? If you want to go through this case, manage properly. Apa benda yang perlu ada dalam your punya tip of finger?
The phase of the dengue and also the complication
Yes, what
that
we call
can...
that. We call that the what? We call what? The
protocol.
The protocol. We call protocol everything.
I don't know.
The knowledge of dengue. Now you see, I don't do small thing. I do a big thing. You need to know all the knowledge of dengue fever. Where you can get the knowledge of dengue fever?
On the CPG books. On the
Pardon?
book.
In the
Textbook.
books lagi?
CPG.
Huh?
Guidelines.
In the books guideline lah lagi. Where you can get the knowledge of dengue?
Seminar.
You tak tahu pakai you punya handphone selama ni?
Website up to date. Up to
No, you
date
can get
website.
only up to date.
The internet.
Yeah, the internet. The knowledge, everything, you are inside the internet. Just why when Azrin present the case, I know he doesn't go through the dengue very well. Because there are many things that you can discuss about this case from history alone. Many things you can discuss from the history alone, but you baca materi dengue? Azrin?
Yes.
Huh?
Yes, I read from internet, from CPG guidelines and
Okay, what is patient there, what is patient is not there? Apa yang ada dalam patient ni when you reading your dengue, apa yang tak ada dalam patient ni when you reading about dengue?
yang ada is fever, headache, mild knee joint pain, mild abdominal pain, lethargy, history of recent fogging, current family history of dengue.
That one is stupidnya lah. I want clinical history. What is there, what is not there? You mentioned what is there, what is not there?
Not there is there is no rash, no retroorbital pain, no bruising or mucosal bleeding, no diarrhea, no liver enlargement.
How you know liver enlargement dan history?
Mana? Physical examination.
But you're talking about, let's say, liver involvement. What symptom going to be?
Abdominal distension.
The distension, tak baca lah tu.
Tenderness.
Bukan tenderness. Okay, tenderness or the child will complain, pain at the where the liver?
Right upper quadrant.
If somebody touch or tingling pain around that region because the liver is inflamed. Apa lagi dia is not there? Apa check sekarang? You thought you already check last night dah. See, you tak tahu nak baca around your patient.
Assalamualaikum warahmatullahi wabarakatuh. Perhatian kepada semua kenderaan Sultan Ahmad Shah Medical Center, para pesakit dan perawat sekalian. Waktu salat zuhur akan masuk dalam tempoh 15 minit daripada sekarang. Marilah kita bersama-sama menunaikan salat di awal waktu kerana Nabi Muhammad SAW pernah ditanya, apakah amalan yang paling terbaik? Lalu baginda menjawab, salat di awal waktunya. Untuk maklumat, salat fardu boleh dilaksanakan secara berjemaah dan mengikut SOP yang telah ditetapkan. Adalah dimaklumkan bahawa tiada pelawat dibenarkan untuk melawan pesakit dalam tempoh PKP. Hanya seorang penjaga dibenarkan untuk menjaga pesakit di ward pada satu masa. Sekian, terima kasih.
How you read around patient? What the dengue can have, patient dengue can have. Let's say you're talking about the dengue disease itself.
Patient might have myalgia.
Dia lagi, apa lagi?
bone pain, shortness of breath. Shortness of breath.
Why the child can have shortness of breath?
Due to pleural effusion.
You see, that is how you read around your patient. Apa lagi?
Shock in severe case.
Lagi, how the patient present with severe shock?
Cold, clammy skin. Cold and clammy skin.
Pardon?
Due to cold and clammy skin.
History saja. You go to history dahulu. Kita tak pasti nak pergi pada physical examination.
Whether patient alert or conscious.
Patient alert or conscious. Patient will look ill. Disoriented. Mother will describe the child. Color can be pale looking. Cold and clammy. Poor urine output. Bleeding everywhere. From the gum bleeding from the nose, specific bleeding from the skin. Tak boleh nak imagine, you know. If talking about complication of dengue, Afiq, what you want to know in the history? Complication of dengue. Saya tak baca malam. So you see, problem with you all ialah, you know, I last time sebelum I present, my colleague present, I will ask already 1 day, 2 days, what case are you going to present? I will present dengue fever. So what I do, malam tu ada study dah dengue fever. So that when they have discussion on dengue fever, I know already what to ask, what is to discuss. But many of you doesn't do that. Okay, let's say Afiq, you dah baca malam tadi dengue fever.
Dah.
Okay, you tell me what you want to know the complication of dengue in this case.
Dehydration.
More important than that lah, please. Dehydration is complication dengue ke?
No.
Kata dah baca malam tadi.
The shock. Dengue shock syndrome.
They have been discussed already just now. Not
Yes.
dengue itself, the complication. That one the natural history of dengue. Tengku Nurin. Google complication of dengue infection. Google. Google. Baca.
Here, the complication can be febrile seizure.
Okay. Lagi?
Hepatic dysfunction.
Lagi?
And then myocarditis.
Lagi?
Fluid and electrolyte loss.
Lagi?
Brain damage.
Lagi? Brain damage. What call that? Tak bagus you punya ni. Encephalitis. Lagi? So if talking about patient worry about encephalitis, what are the symptoms you worry about the patient going to have?
Seizure.
Lagi? Seizure lagi? Seizure only?
Confusion.
Yes, confusion. Lagi change in sensorial. So did patient have this? If
No.
talking about myocarditis, what the symptom the patient can have?
Cardiomegaly.
Symptom,
Cardiomegaly.
nak ketembak ke? Ada tak sebab sign kemudian usually we go symptom dahulu. Myocarditis can present as apa?
Chest pain.
Can present as is to affect the cardiac function. What happen to the ni? What we call that? If they affect the cardiac function, the cardiac become dysfunction. When cardiac become dysfunction, terpanggil apa?
Heart failure.
Cardiac failure. So what the symptoms of cardiac failure?
Shortness of breath.
Lagi?
Fatigue.
Fatigue lagi?
Edema at the lower extremities.
Okay. Yang ke-5 lagi?
Rapid or abnormal heart rhythm.
The one you don't know lah kan, symptom je dia tanya. Okay lah, palpitation, sound. Lagi apa lagi? Sign center, autopnia, decreased effort tolerance. So I ask you, susah ke medical ni? Kita recognize sign and symptom dengan fisiologi, anatomi. If you read along your patient, you dah belajar what? Dengue, you dah belajar myocarditis, you dah belajar encephalitis, you dah belajar hepatitis. Banyak benda you dah belajar. If you read along patient. So your job is to see what is there in your patient, what is not there in your patient. How you want to know what is not there, what is there in your patient?
History taking.
Yeah, from proper history taking and physical examination. But if already your brain already know what the dengue all about, yeah, your brain already know what's the dengue all about, don't you think that you're going to ask a better question? Or don't you think that you can present better than this? Because you already know about the dengue. So tell me, what's the susah sangat medicine ni? Susah? Susah ke Afiq?
Should be tak susah tapi kita yang buat susah.
Kenapa you rasa you buat susah?
Sebab tak kena method study.
You notice that what is the most important thing yang ada, yang if you can have this, what is the most important thing that can tie up things, everything? That tie up everything.
History.
Yes, history, everything. Dan nak tie out though. What the most important thing you kena ada? Lagi apa?
Knowledge.
Knowledge you ni, tapi you dah baca, tapi nak tie up macam ni, nak tie up knowledge, history dengan passion semua.
Kena jumpa patient, practice.
Practice banyak, tetapi kalau practice 3 kali, ada orang tu practice sekali je, ada orang tu practice 3 kali dapat. Ada orang practice sekali dah dapat dah. You have to have nombor satu. We call that common apa?
Science.
Common sense. Don't you notice everything is just common sense only? You don't notice that. You need a very difficult thinking to tie up those things, or you need simple thinking. Yeah. Need simple thinking ke complicated thinking? Something very complicated, or something not very complicated.
Simple and organized.
Looking back, is it difficult to know that dengue can cause myocarditis? Myocarditis can cause effect to the function of the heart. Effect the function of the heart can present sign and symptom of heart failure. Itu susah. Dengue can cause encephalitis. Encephalitis affect the function of the brain. The function of the brain represents sign and symptom of brain dysfunction. Susah. Susah tau. Is it so difficult? Ask you, susah ke tu?
No.
Itu complicated to think, is it? The knowledge is dengue can cause. The knowledge is dengue can cause encephalitis. Then they present the physiology, everything semua is the function of the brain. The sign, the symptom is the clinical. But the history will tell you if the patient, what patient have, what patient don't have. Tak nampak lagi? Masih tak nampak lagi? You didn't see yet? Have you seen or you seen yet? You see, there is clinical all about. The essence of clinical is to tie out your patient with your knowledge. That is clinical. So the basic thing you must have the knowledge. But if your knowledge you just baca saja untuk exam, you akan kat situ sajalah. After exam you forget about it. But if you you have your patient, you tied up your patient, we're taking proper history dulu physical examination, you compare to your knowledge, you know what your patient is having, you know what patient is having, how severe your patient is, how bad your patient is, and then you know how to manage. Knowing the diagnosis is not enough. Bukan semua ada patient ada myocarditis, bukan semua ada patient shock, bukan semua ada patient ada rash, bukan semua ada patient ada petikir. It is your job to tie up what is there, what is not there. That's what we call clinical. Clinical. That is what the thinking process going to be with you for your rest of your life. If you want to stay this profession now. So how to be fluent? The thinking process. Kena banyak apa? Apa?
Practice.
Practice. No magic bullet. Some of you, because the way they were brought up, The way they brought out, the way they are thinking, they probably need 1 or 2 cases only, because they already have the brain inside their brain, all the why dah, when, why, how, cause, everything. Dan otak dia dah macam tu dah, otak dia. And then probably one clucking, 2 clucking, dia dah okay dah. Some of you, your brain in narrative brain, narrative brain is you are only able to narrate but not critically thinking about the problem. Probably you need more clucking compared to the other, because you see, you may have a lot of knowledge, you may read a lot, banyak, tebal buka, you know, dengue tu tebal ni, dengue can be this thick book, you can read, but if you are unable to type out your patient, it won't help you much. You know, because your brain is narrative brain. Your brain bukan tak is ada question. Why, where, when, tak ada otak, you tak ada that kind of brain. And then you need more practice than the others. Itu sajalah. So I ask you one thing, question. Susah ke medical tu? Baca susah. Senang kan baca kan? You baca, you buka. Sekarang ni kan you nak baca dalam tengah makan pun boleh. You nak baca tu pun boleh. Dulu kita orang nak share apa-apa kena pergi library tau. Sekarang you all need to go to library to find knowledge. Sometimes di Wikipedia pun dah banyak dalam. Dah quite good already. Just matter of you nak baca dalam tandas ke apa ke, you can always refer sekarang. It's not a problem anymore to get the knowledge. Now you have to have the skill how to extract proper knowledge from internet. Sebenarnya kena ada khusus untuk you all ni. How to get optimize the knowledge from internet. So you know how to extract the knowledge from the internet. Because I think internet will become very important factor in the knowledge to get the knowledge. Actually you all sekarang ada banyak time free tau. I tak faham, susah sangat you all, tak busy sangat. Everything nak buka buku, everything tak perlu dah buka. You can spend time. Sepatutnya you all banyak masa dah nak relax. Tak perlu macam kita orang dulu kena cari buku, beli buku tebal-tebal, buku ni. Yalah, you all baca buku Nelson tebal tu. Ya. You buka buku Nelson. You tahu buku Nelson?
Tahu.
Nelson Peace. You buka tu ya?
Ada juga lah tengok.
Ya. You tahu tak, I cuba buka buku tu buat master je. I tak buka buku tu pun masa I undergraduate. You rasa siapa yang suffer? Orang yang buka buku tu ke orang tak buka buku tu?
Yang buka buku. Yang buka buku.
Siapa yang buka buku tu akan suffer lah. Minta maaf lah Memang akan suffer lah. Dia tengok buku tu pun dia dah apa tu? Depressed dah. Tapi many of us tak buka buku tu pun. I punya buka master pun, ada Nelson ya. Okay, any questions? Any question tak?
Ada. About fever, kalau patient dia datang dengan chief complaint of fever, lepas tu kita nak tahu interfebrile period dia.
Some parents are very contentious. Some parents are not. Some parents can tell you that the child is having fever, lepas tu go off, the fever go off. So we call intermittent. Some parents are good. Sampai cakap fever 2 hari hilang, datang balik to tertian. Some fever, depend. Tapi ada fever kata kalau demam, sentiasa demam, continuous demam, tak pernah hilang. That is persistent fever. Okay, it sometimes help you to tell you what the possible diagnosis, especially if you are coming with tertian, quotient, and then will tell you that oh probably something or persistent fever. Sometimes it doesn't help you. Sometimes it tell you help you. Depends. But the characteristic of fever is itulah intermittent, persistent fever, because it helps you severity. You are worried more if the child having persistent fever than intermittent fever. The second thing is the how high temperature is 38 degrees, 40 degrees, 38 degrees jadi viral dia. Kalau 40 degrees you think it probably is a non-viral, probably bacterial. But saying that certain fever like influenza and also H1N1 ataupun COVID, dengue, the fever can be high and persistent. It helps to give you clue in terms of etiology. Okay, any other question? You tahu kan Madhul kan, no question mean that apa?
Tahu.
Yeah? No question mean you know
Everything.
everything. It's no question about. Or you know nothing because you don't know what to ask, nothing you know. Or you know everything. So ada question tak? So I have to presume you all know everything lah.
I want to ask.
Ah.
In physical examination of this case, it is stated that her lip was dry and she had coated tongue. Coated tongue is associated with dehydration ke?
Coated tongue associated with inadequate fluid.
Okay.
It can be a sign of dehydration, but sign of dehydration has to be many other things other than coated tongue. It better be dry lip, dry mucosa. But talking about that, certain disease can come with coated. Example is scarlet fever. It can come with coated tongue. Any other questions?
I have a question. For critical phase of dengue, do we only call it when there is the drop of temperature, or it depends on the what day of the illness?
Critical phase of dengue depend on clinical feature. Because the afebrile period ni, not all patients have afebrile period. Saddle ni 10-20% patient you have afebrile period. It tell you that the child is the afebrile. I mean the infective process is already complete, but now the problem with the immune process. So you got afebrile period. Usually at day 6 and day 7 after the 5th day. It just tell you there, but you have to look the critical period in clinical also. That's why in dengue we calculate day 1, day 2, day 3, day 4, day 5, day 6, day 7. Because once they reach day 5, we're going to be very careful. Especially when child start to become afebrile. And that's why we only discharge patient after 40 hours of febrile. Any other questions?
Doctor, I want to ask if the patient have the dengue fever, but they have the underlying comorbidities like the asthma. Is there any difference in the severity or management?
No.
No.
Same.
Thank you.
Lagi?
Based on these cases, kalau kat HPI tu, it stated that patient ni receive normal saline. But she drink water about 7 to 8 glasses, and the frequency of the urination also normal. which indicate that maybe she is not dehydrated, but why she received normal saline?
Then kita ask doktor yang in charge dia lah. Tanya dia, marah ke doktor tu. Kenapa you ni? I think the patient doesn't need normal saline, drink well, why you still to put normal saline? Dia tanya doktor tu, marahkan. I tak tahu. Because I tak tahu management dia. Maybe, I don't know. You yang kali jumpa doktor tu, you marah doktor tu. In my opinion, the child doesn't need normal saline infusion because she can take orally normal. Berani cakap macam tu? Berani tak? Kau tak berani pula. You kena ni lah cakap. Although I am still medical student, I believe your management not that proper. Berani cakap macam tu? Cakap je. Stand on your feet. Atau cepatlah kata kita cepatkan graduate you. Kata bagus budak ni. Very attentive. You notice something's not right. Jadikan you 4.5 years. You do 5 years tu 4.5 years ya. Okay, boleh ni tau nak. It's a good question, but I am unable to answer you because I am not the one who managed the case. There must be a reason why he did that. But right, the child, maybe the PCV still high during that time. I don't know. So when PCV still high during that time, they're not there to off the normal saline yet. Because each case different. Dia punya tu, ada case you can off, ada case you still not there to off. PCV masih lagi on the high side, 55, 60. Nobody there to off the IV drip. Walaupun the child can take orally well. Until PCV normalize, only you there to off the IV drip. Any other question?
One more question about the criteria of fever. Dia kata kat sini one of the criteria yang kita boleh tahu is the rhythmic features of fever. Doktor boleh tolong terangkan?
Dia apa?
Rhythmic features of fever.
Tak tahu. Daripada internet tu? Mana? Internet?
Yes.
Tahu. Ada tahu. Apa boleh dia dengar rhythmic features? Siapa doktor tu? Siapa? Doktor mana tu? Nama dia?
Ni saya tengok dekat YouTube.
Saya tak
nama
tahu.
Dr. YK MDK.
India?
Yes.
India dia. No comment. Nanti kata racist pula. Tak payahlah nanti. Kita kalau jumpa I personally, I cerita sikit. Sini tak boleh cerita. Recording pula tu. Nanti kata racist pula. Tanya dia. You email dia. Why is it the important rhythmic future? I tak tahu. First time dengar rhythmic future. Mungkin ada something yang dia tahu, yang dia ada extra kajian dia that I don't know.
Okay.
Tapi saya rasa kan kalau you tak tahu pun mungkin selamat, lagi selamat. You very complicated lah. Very complicated. Pemikiran you very complicated. Medicine ni simple semuanya. Any other question? Okay, you tak rasa interesting medical ni? You can go deep and deeper, tak rasa interesting? Boring, menakutkan?
Interesting.
Tak menakutkan? Banyak sangat kena belajar. You rasa medical ni banyak sekali kena belajar?
Ada juga rasa.
Ya. Dia tahu berapa passing mark medical. You rasa kan kalau kat luar, kalau orang luar tahu kan, orang kat luar kan, orang biasa ni, apa dia expected doktor yang passing mark? Berapa persen doktor kena tahu knowledge doktor tu? Kalau you sebagai patient, how many percent you expected doktor tu to know?
Everything. Kalau orang luar mesti dia expect macam dia tahu semua benda.
Berapa persen? 90%?
80.
You masih mark berapa?
50.
That is our secret tau. You need to know 50% je. You fail the 50% lagi. Itu our secret. You think kalau orang luar tahu 50% dia orang happy tak? You would happy kan? Doktor you tahu 50%. You nak ke doktor perawat you tu tahu 50% ni knowledge? You nak ke? You yourself. So what is important? What the 50% is all about. The important 50%. The medical to become difficult because you want to know. Become medical because why? You want to know
everything.
You want to know everything. Betul, you all suffer. Kesian masa muda-muda macam ni, life banyak benda lain boleh buat. To get to know everything. Hidup sekali je kan. You miss you punya masa muda you rasa you boleh ambil balik masa muda you ni. Orang lain kat luar sana dia enjoy the life, you all apa? Rushing sana, rushing sini, baca sana, luar to feel the life you all ni. Do you think that because you want to achieve perfection 100%, they make you all suffer? Kita rasa sedemikian. Itulah anak psycho pula dia marah kat saya pula, so tak minat di medicine. Doktor ni tak menggalakkan pergi buat medicine. Sebab itu medicine suffering. You're suffering tak? Tak, you enjoy it. You enjoy it. You suffer tu, you enjoy it.
Enjoy.
Okay. Azrin, you enjoy it?
Sometimes enjoy, sometimes suffering.
Sometimes apa?
Sometimes suffers.
You know how to enjoy things. How hard is it? I rasa you go group banyak ajar philosophical. Group lain tak boleh nak belajar just philosophical. You know how you want to enjoy things. How hard is it? You enjoy it. You know how?
Do what you love.
What we call one word saja.
Patient.
Redha.
Apa word tu?
Redha.
Patient.
Redha.
Redha tu. Redha tu is, I call it fatalistic thinking. You can have some sort of that, tapi it can be a disease. Fatalistic thinking. You should have what?
Patient.
You have to have passionate with whatever you're doing. Redha ni, redha tu is between you dengan siapa? You dengan Tuhan you. It's something that you dengan Tuhan you. Bukan tahap redha ni different level, different orang, different dia punya. Kalau side Sufi ni, type ni, type 2, redha ni redha. Itu you dengan Tuhan. Setakat mana you redha. Tapi kalau you want to be, if you want to enjoy what you are doing, you have to passionate what you are passionate. If you passionate what you are doing, all the challenge, everything semua become passionate. Passion. Sebab tu tengok orang tu kalau dia melukis, passion dia melukis sampai buat benda lain, lukis dia boleh, because it's about the heart. About the heart of, and all the person I have seen who successful in their field because they are passionate in their field. Passionate ni boleh build tak? Kata you tak minat benda tu, can you build the passion on that things?
Yes.
Orang lelaki yes, orang perempuan?
Yes.
Yes also. The girls will be more difficult. The girls they have more, their heart is more powerful daripada orang lelaki, tahu tak? You don't believe in me? Yeah? The heart orang perempuan, heart dia lebih kuat daripada orang lelaki, tahu tak? You tak percaya? You ask yourself, siapa yang lagi lebih steady, your mother or your father? Yeah? In term of
Father.
father. Oh. Father tak huha sekejap ni, down up down ni kadang boleh decide apa benda sebenarnya dia buat, tak tahu
Ayah biasa maintain.
Sometimes you know the man's heart, you nampak dia keluar steady, tapi semua duty sebenarnya perempuan, balik kerja, masak ni semua, pada duduk depan TV ni semua. Woman balik ke rumah, first thing dia do tengok anak sihat tak sihat, ada problem ke ni semua. Dia multitasker. Ayah apa buat balik rumah?
Tengok TV3.
Ya, dia pun jawab. Okay, any question? If you tak apalah, sebenarnya kan the problem of ni, the boys ni, siapa salah siapa sebenarnya, you think? Who can train the boys to become multitasker? Who should train them? Who can train them?
Isteri dia.
The
Parents.
The mother.
Oh, mother.
So you all jadi mak besok, you tahu lah how to train you boys. Sekarang you have to give them equal type of work between male and female. Ni yang basuh pinggan semua apa?
Female.
Kalau perempuan tu, lelaki tu keluar pergi ni, manalah dia orang pun the task about that, they think is female task. So you have to, it's up to you all. So it's not the man's fault kan. Okay, any questions? Habis? Okay lah, you can go and think about it. Muhasabah, I always tell the student lepas I teaching you do and thinking muhasabah sikit. Because I'm teaching you all the thinking process, how to make your belajar tu simple. Because I don't believe medicine is difficult. It's all inside. It's all about your thinking process. And I believe that you should able to enjoy your medical life, and then you have to enjoy it because you are spending the cream of your life. Duduk dan belajar medical ni, orang lain yang belajar art, belajar apa, you tahu kan dia orang kan, bila nak belajar nak exam pun nak belajar kan. You all need exam every 7 minggu exam ya. Every 7 weeks exam, sekejap dia exam, habis sekejap exam. What kind of life nak buat macam mana kan? So you have to lah, you kena adapt lah, you have to enjoy it. Kesian you all to enjoy. Okay, finish. Okay.
Thank you, Doktor. Keluar dah.
Thank you semua.
Thank you, Azrin.